Very good morning, doctors. So, welcome to another session of medicine Inicet. Previous year topics, very important, very important star topics, right? So, let us get into the question without making any delay, right? So, what's the question? So, the clinical presentation of multiple system atrophy is all except. You have the options here. One is Scheidegger syndrome. Second one is striatonigral degeneration. Third one is olivopontocerebellar atrophy. And fourth one is LB dementia. LB means Lewy body dementia. What's your answer? Everyone, I'll give you 5 seconds. Just go through the options and just try to pick one. Okay? No cheating. Just be frank, right? If you cheat here, you cheat yourselves, right? So don't cheat here. If it's wrong, no problem. Just try to revise. That's it. You will learn the topic. Okay, so what is the clinical presentation of multiple system atrophy? Is all except. The clinical presentation of multiple system atrophy is seen in all except. Okay, so you are ready with the answers. Let us get into the explanation, right? Okay, so what is a multiple system atrophy? First of all, we'll discuss this one. Very important, guys. It is for Inicet as well as NIMHANS. Even NEET PG also right now they are giving these type of degenerative diseases, right? So what is multiple system atrophy? Very important. Just listen carefully. A multiple system atrophy is a condition. It is actually a sporadic neurodegenerative disease. Sporadic neurodegenerative disease, right? Actually, you can take it MSA, that is multiple system atrophy. It is actually one of the synucleinopathies, right? It is actually one of the synucleinopathies, right? It is actually a neurodegenerative disease which is characterized by varying degrees of cerebellar ataxia. You see, varying degrees of cerebellar ataxia. Very important statement, guys. Just please remember, you see varying degrees of cerebellar ataxia, as well as there will be a presentation of autonomic dysfunction. Right, previously in some scenarios we will discuss this feature. Autonomic dysfunction is also present in some conditions. Please revise it, right? As well as there will be a Parkinsonism like condition. And you also observe corticospinal dysfunction is the primary thing. Dysfunction, okay? Now in all these things you should remember this third point. Parkinsonism like condition is also seen. Now that is what is defined as a multiple system atrophy. It's just as neurodegenerative diseases. See, these days neurodegenerative diseases are frequently asked in the examinations. Why? Because most of the times these days we are commonly seeing these conditions in most of the people, neurodegenerative cases, because a lot of stress, depression, all sort of this lifestyle, everything, right? Now, what is the epidemiology? If you come to the epidemiology, what is its incidence? What is its condition? It's actually a sporadic disease, so just leave it off aside. And its prevalence is something like 4 per 1 lakh population. 4 per 1 lakh population, and it's mostly seen in a 4th decade to 6th decade of life. 4th decade to 6th decade of life. Okay. Now, if you come to the clinical presentation, I'll just change the color for your benefit. If you come to the clinical presentation, so what do you actually observe? So actually the MSA, that is, see, in shortcut I am calling it as MSA. See, this is also called MSA. MSA means multiple system atrophy. So MSA has 3 patterns. What are those 3 patterns? First one is called Scheidegger pattern. Sorry, not sky, it's actually shy, sorry. It's called Scheidegger pattern, or it's also called Scheidegger syndrome. That is the first pattern. The second pattern, the second type is SN degeneration or striatonigral degeneration. Guys, listen carefully, concentrate here, okay? And the third finally, that is olivopontine cerebellar atrophy. See, I am just writing some shortcuts or I am writing short words, right? Don't think like I am writing spelling mistakes, please. Okay, so that I can save some time. Okay, that is why I am just writing shortcut. Sir has forgot here to write AR. See, don't check all those things. You just only listen to my voice. Okay, so multiple system atrophy has three forms, three patterns. First one is Streitrager syndrome, second one is striatonigral degeneration, and third one is olivopontine cerebellar atrophy. And you can also call these conditions as MSA A type of pattern, MSA B type of pattern, and olivopontine cerebellar atrophy is MSA C type of pattern, right? So three patterns we will see. Now, in which conditions we call the so and so patterns? In which conditions we determine whether it is pattern A or pattern B or pattern C? See, Streitrager syndrome is generally used when there is more of a predominant autonomous symptoms. If you see autonomous symptoms predominantly, then you can refer that one to MSA A type of pattern. That will be designated as Streitrager syndrome. Now, if the so-called MSA predominantly shows Parkinsonism features, then it will be denoted as striatonigral degeneration or MSA B type pattern, MSA. Okay. Now finally, olivopontine cerebellar atrophy. When you will call it, obviously, if there is any sort of primary cerebellar dysfunction, then you will denote it as olivopontine cerebellar atrophy or MSA-C type pattern. Okay. So these are the three patterns in a multiple system atrophy. Now you should remember one statement, very important. What is that? Actually, the autonomic symptoms that we discussed here, the autonomic symptoms are actually considered the part of both MSA-C as well as, see here, the part of both MSA-C as well as MSA-B also. So actually the autonomic symptoms are part of both MSA-B and MSA-C. So that is the reason I think in recent textbooks or in recent most of the books you don't see MSA A type of pattern. You don't see this. Only MSA B or MSA C is present. Why? Because these autonomic symptoms are also included in the MSA B as well as MSA C. So MSA A you don't observe in recent textbooks. Okay. So just leave it aside. No problem with it. So we'll just go on with the topic. Now, actually, what sort of pathology you see in MSA? What sort of pathology you see in MSA? Now this is important, listen carefully. What sort of pathology, right? So like all the other synucleinopathies which you already studied, MSA results from abnormalities in alpha synuclein metabolism. Abnormalities. Okay. So it is the result of abnormality in alpha synuclein metabolism. So this leads to intracellular deposition. Okay. Now you should understand one thing here. Unlike Parkinsonism, which we already discussed, unlike Parkinsonism disease and Lewy body dementia, what actually you should observe here is these intracellular deposits are found not only in neuron but also in oligodendroglia too. Okay, so unlike this Parkinsonism and Lewy body dementia, these intracellular deposits, right, they are present not only in neuron, they are present in neuron as well as in the oligodendroglial cells also. Oligodendroglial cells also. Okay. So what are the radiographic features? If you ask me radiographic features, then obviously MRI is the modality of choice. Obviously MRI is the modality of choice for any suspected patients with MSA. Now someone might ask, sir, what are the features that we see in MRI? See, features means nothing much. Generally, if you observe the MRI scan of MSA, obviously you see some hyperintensities. They are actually present in the pontocerebellar tracts. There will be hyperintensities present in the pontocerebellar tracts. I think this one most of the times you don't recognize in MRI, but the important statement that you should remember is hot cross buns. Hot cross buns sign, which is one of the peculiar sign you see in the MSA pattern C. Okay, then you can go on with, there will be some reduced volume, reduced GRE and T2 sign related to globus pallidus, reduced GRE and T2 signal related to red nucleus, and there will be sometimes an abnormally high T2 linear rim surrounding the putamen, right? Now that one is called something you already read in the radiology, the putamen ring sign. The putamen ring sign. The putamen ring sign. Okay. Now if you just discuss something about MSAC, right? We'll just discuss something about MSAC, which is very important. There will be actually presence of a disproportionate atrophy of the cerebellum as well as the brain stem also. Cerebellum and the brain stem also. Remember, it is very important. Guys who are going for INSCT, these all are important, right? Don't go blindly to the exam without reading this, okay? So if you ask me in the brain stem which ones are, especially it will be in the olivary nuclei. Olivary nuclei, and another one is middle cerebellar peduncle. Middle cerebellar peduncle. Now if you ask me about the ADC values, someone is asking about the ADC values in the previous examinations, right? There will be a slightly higher in pons, cerebellum and putamen. When compared to Parkinsonism, I am just telling these values, when compared to Parkinsonism, the ADC values will be higher in pons, cerebellum and putamen, right? Now if you ask me about the fractional anisotropy, it will be lower in pons, cerebellum as well as the putamen when compared to Parkinson's disease. Now most important one is, what is the treatment and prognosis? See, no effective treatment for multi-system atrophy. Always remember, no effective treatment. And if you ask me what is the prognosis, it is very simple. The disease go on progressing and the death usually occurs at a range of 10 years. Now this is all about MSA. Okay, thank you.